The homeless college student, low-wealth college student, struggling college student is something that not many people put together. It's very personal for me because I've been in that position myself. When we got the call from Savannah State, normally there's around 15 students in the STAR program, but as a result, there were 20 extra students that were international students that could not go home due to COVID restrictions. So we had to come up with an idea to meet the needs of them, as well as being within the boundaries of making sure that this is food that they wanted to eat.
We started the STAR program in response to students who were in foster care having some basic needs met. And we started it out of our own pockets. One of the other counselors and myself, we started out of our own pockets, we bring things from home. Then they started spreading that people could get help. And other people would come up and say, oh, well, I heard that I could get, laundry detergent up here. I could get sanitary napkins up here. And then we reached out to the campus, and the campus responded overwhelmingly.
We kind of shifted gears once COVID-19 struck, and we created a category known as coronavirus help information. And within that category are different services that are available, such as food deliveries, food pickups.
What we hope to do is to let people know that Healthy Savannah is out here working on a policy, systems, and environmental change level to get at the roots of the disparities in health between Black folks and white folks.
Actually, I'm gonna get 2 more zucchini.
So the food truck it's 7 days a week. We are set up in different communities throughout Savannah to improve food access in these neighborhoods. Most of these neighborhoods are low-income, low-access neighborhoods, and our goal is to provide access to individuals so that they have fresh, healthy produce, and that's available to them at all times.
We happily worked with Savannah State, understanding that campuses all over the country are hurting.
One of the things that I think people think about is when kids go out on their own that they're self-sufficient. And we've learned that there's still kids and there's still people who are finding their way in new situations, and especially being international students in a strange country, unable to go home, unable to find the comfort of their families. We found it was really important to support all these populations that may have been forgotten or not in the forefront.
I think SSU is a cornerstone to the city of Savannah and Chatham County. Many of the leaders that we have within this city and within this county all hail from Savannah State University.
Because the food systems are vulnerable at this time, it's so important that we assist in that area with the students, because we want them to be able to continue to focus on their studies and on building a stronger and healthier community after graduation.
With the school systems, Savannah State and other colleges and local schools as well, being sure that kids are getting nourishment and getting access to people to see that they are being fed is very, very important.
Realistically, this was the brainchild of figuring out how the community can come together. At the end of the day, we are responsible for ensuring that the next generation is able to move forward.
Hello, this is Dr. Elena Serrano, the director of the Virginia SNAP-Ed program, the nutrition education arm of SNAP. Our program aims to support healthy eating and movement among SNAP participants across the Commonwealth of Virginia. During COVID, we have found that the need for our programs and initiatives has increased. With a strong team of employees, we have been able to pivot our approaches to a number of online platforms, such as the ones you will learn about today.
446,000 more Virginians are experiencing food insecurity during the COVID-19 pandemic. Despite being important food access points, farmers markets were deemed as non-essential businesses in Virginia Executive Orders 53 and 55. Virginia Fresh Match, a statewide network of farmers markets and food retail stores that offers point-of-purchase nutrition incentives for fruits and vegetables for SNAP shoppers, addressed increased need of SNAP consumers while working with farmers markets to ensure they operated according to restrictions. Virginia's Fresh Matches approach included lifting caps on SNAP Match to increase SNAP consumers' buying power, working with policymakers to set realistic restrictions on markets, providing technical assistance to markets to comply with new operative restrictions including online sales, and targeted social marketing focusing on pandemic EBT recipients.
FNP Talks are a series of scripts and handouts that were created in response to food insecurity issues exacerbated by COVID-19. FNP Talks provide direct education on shopping, food resource management, and emergency food sources to SNAP-Ed eligible adults by phone. Education by phone was chosen to address the disparities of internet usage, especially in rural areas of Virginia. One SNAP-Ed educator stated, "Right now, we can't get out and they can't get out. It's a good avenue for us to get education to them. It was a bonding thing and it just worked. They have anxiety during this time about getting to the store and it helps." Some FNP Talks topics include shopping with limited options, getting kids involved in the kitchen, how to start your own vegetable garden, and shelf-stable foods. To date, a total of 154 SNAP-Ed eligible individuals across Virginia have been reached, and 4,500 have received related handouts.
The Gardens to Go programming opportunity empowered SNAP-Ed educators to connect with community organizations that support youth to offer gardening education and nutrition education through a small grant opportunity to distribute materials for container gardens to SNAP-eligible individuals across the state. Each participant received an in-season produce packet of seeds, a container for potting, and worked with SNAP-Ed educators to properly pot the produce. This opportunity capitalized on the increased popularity in food gardening as a response to the COVID-19 pandemic. This initiative aims to provide a constructive and beneficial activity for youth that gives nutrition education in a physically distant manner while also equipping participants with a new skill set for food procurement. Participant feedback has been extremely positive, which prompted our program to offer another cycle of opportunities to reach more youth.
Teen Cuisine is a cooking-based nutrition education curriculum that was developed by Virginia's Family Nutrition Program to help address nutrition shortfalls among teens and promote healthy eating at home. Due to COVID-19, in-person Teen Cuisine programming was terminated. So, Virginia's FNP quickly worked to adapt the program to an online virtual format. Google Classroom was chosen as the teaching platform for Teen Cuisine due to its use by many schools across Virginia. The online format is comprised of 6 condensed lessons that deliver nutrition education content accompanied by videos, recipes, quizzes, and homework assignments. In addition, Virginia's FNP offered Teen Cuisine at Home, a mini-grant program delivered through Zoom. This program provided funding for cooking and recipe kits and nutrition education to SNAP-eligible youth participants enrolled in 4-H programs across Virginia.
Through our partnerships and collaborations, we plan to continue offering these and other innovative programs to meet the changing needs of Virginians during the COVID-19 crisis and beyond.
Hardeman Healthy Outreach for Healthy Weight, or H2O, is a CDC-funded high obesity program in Hardeman County, which is a rural county in Tennessee. One of the objectives of this community-based program is to increase access to nutritious food in this county.
In 2019, we conducted a needs assessment in the 8 incorporated towns in the county. Our results show that access to healthy foods, particularly fresh produce, is a challenge in an area of concern among residents.
More than 16% of households in Hardeman County were food insecure at some time during 2018. The COVID-19 pandemic has exacerbated the already existing challenges with food access. It is estimated that about 21% of residents in Hardeman County may experience food insecurity because of COVID-19. One of the underserved parts of the county is the city of Whiteville.
Whiteville, Tennessee is a small town in Tennessee. Our our population is around 4,000, which includes 2 prisons. Without them, it's probably around 2,000 or so-ish. There's not a lot of job opportunities here in Whiteville, but we kind of have to travel to go do our main shopping for groceries and everything, since the only grocery store we have in the city limits closed down.
Basically consists of kind of senior people. It's kind of a bedrock type community. The needs are, definitely there for transportation, as far as getting to and from places to get adequate groceries.
We were a little bit confused on how, if we should continue the program, because everybody was a little scared, but we never quit. All the volunteers still came, and on the dates we had distribution, and we were concerned if the people were going to come out and actually get the stuff that were registered, but people showing up.
We were actually able to provide some training for the food pantry staff, as well as to be able to assist them to increase their capacity to allow healthier foods. That included adding a refrigerator and freezer to their pantry. And we also were able to create some nutritional educational materials for the food pantry clientele, which would help make it easier for them to make healthy choices. Our team also coordinated a food pantry distribution. We were able to partner with a local dairy distributor, Prairie Dairy Farms, and distributed 240 20-pound dairy boxes within an hour and a half. There were a lot of smiles and a lot of thank yous that day, especially from the residents who may not have those resources readily available to them. We're able to provide 30 meal kit bags, which included fresh ingredients.
The SNAP Market Match program helps SNAP recipients get more at farmers markets by matching SNAP dollars spent with additional tokens to load up on fruits and vegetables. Last year, WSU Extension Clark County's SNAP Ed and Food Safety and Nutrition programs partnered with Clark County Farmers Market to promote SNAP Market Match locally. They provided farmers market tours in Vancouver and Camas, where SNAP recipients were familiarized with the market, introduced to vendors, and learned how to use SNAP benefits and SNAP Market Match. When the pandemic hit, market tours were halted. Instead, the team has created virtual market tour videos, which helped the team to reach a broader audience across Clark County and also included important COVID safety information. The first video, which highlights the Vancouver Farmers Market, has accrued more than 7,000 views, and the Washington State Farmers Market Association decided to use it as a template to promote the SNAP Market Match program statewide. Soon, SNAP shoppers throughout the state of Washington will have access to the WSFMA version and will be encouraged to shop smart, shop safe, and shop local at Washington farmers markets. EBT users in Vancouver can now receive up to $20 to spend on fruits, vegetables, mushrooms, and plant starts every time they use SNAP benefits at the farmers market. This video will show you how to redeem your SNAP Match Market dollars in 5 easy steps. First, you'll need to make sure that you arrive at the market prepared to shop safely. Farmers market staff are working hard to protect the health of shoppers and vendors at the farmers market by closely following protocol put out by the Department of Health. Before you go to the market, please be ready to practice social distancing by maintaining a 6-foot distance between yourself and others at all times. Use hand washing stations when entering the market and regularly while shopping. To eliminate contact, don't handle unpurchased products while shopping. Use card or exact change when possible, and bag your own purchases.
Be prepared. Send only one person per household to shop. Pre-order products if possible. Shop and depart the market quickly. Do your part to prevent the spread of coronavirus. Stay home when sick or experiencing symptoms such as fever, cough, sore throat, or shortness of breath. Cover your coughs and sneezes. Wear a cloth face covering if you have one, and avoid touching your face. Next, locate the Market Information Booth. The Market Information Booth is located at the corner of 8th and Esther. Find a staff member at the information booth and tell them how much you'd like to spend in EBT SNAP benefits. They can match every SNAP dollar you spend up to $20. The staff member will swipe your SNAP EBT card and give you your SNAP tokens and SNAP match dollars. Now you're ready to shop at the farmer's market. Use your SNAP tokens to purchase anything you could buy with your SNAP card at the grocery store. Your SNAP Market Match dollars can be used on any fruits, vegetables, herbs, or mushrooms. The Vancouver Farmers Market has a new way to shop. You can now shop online for low-contact curbside pickup on Sundays. The link for online farmers market shopping is in the description box below. We hope to see you at the farmers market, where SNAP users can always shop smart, shop safe, and shop local.
The Food is Medicine Partnership, established in 2017 by Grady Health System, Open Hand Atlanta, and the Atlanta Community Food Bank, seeks to combat food insecurity and chronic disease at Grady. Together we offer produce prescriptions and meal prescriptions in both inpatient and outpatient settings, as well as employee opportunities. Community organizations including Wholesome Wave Georgia, Common Market, and Emory University also play important roles. With health inequities only worsening during the COVID-19 pandemic, we quickly mobilized to adjust programs to meet new guidelines and to innovate to reach more patients and employees.
Continuing the program that launched Food is Medicine, Georgia Food for Health, was critical for 2020 because the impact has been so clear. This 6-month produce prescription program with nutrition and cooking education has reduced food insecurity by 31%, significantly increased fruit and vegetable consumption, decreased sweetened beverage intake, and improved BMI, waist circumference, and blood pressure among previous program graduates. The 2020 program year was set to launch in April but was delayed due to safety concerns, especially as the patient population live in communities disproportionately impacted by COVID. Partners surveyed patients to understand technology access and preferences and plan for an alternative model. Participants began enrolling in August for an abbreviated but still comprehensive program. Instead of redeeming produce prescriptions at a local farmer's market, Common Market is delivering boxes to patients. In place of in-person cooking matters offered by Open Hand, patients are participating in an online version through the Healthy app. Live and recorded cooking videos align with the produce delivered to patients. Participants also visit the clinic sites 3 times for biometric data collection and to complete surveys. 62 participants are currently enrolled across 4 sites, and we're looking forward to a great year.
The Fresh Food Cart, our mobile food pharmacy, provides fresh fruits and vegetables at no cost to Grady's patients. It began in June 2019 at Grady's Brookhaven Health Center. Twice per month, patients picked up 20 pounds of fresh produce. COVID made it necessary for us to switch from a walk-up model to a drive-through model to reduce contact and to schedule patients to minimize wait times. In this way, patients receive a pre-packed box without getting out of their car. They also get recipes, COVID educational materials, and other food resources. After observing the number of patients increase significantly, we expanded the program to 2 more Grady clinics. We went from serving 200 patients at 1 location to about 800 at 3. As of September 2020, we've conducted 37 fresh food carts with nearly 7,600 patient visits and 152,000 pounds of fresh produce distributed. Through laughter and even tears, patients continually express their gratitude for receiving the support, especially during this crisis when many have lost a source of income. We are working with our partners and clinics to be able to continue this program to support food access and chronic disease management.
As a major hospital system, our employees have been at the epicenter of the pandemic. When offered weekly produce boxes through the USDA Farmers to Families program by our partners at Common Market, we immediately said yes. The Grady Food is Medicine team quickly mobilized to implement an employee nutrition program to complement our patient offerings. From May through August, over 2,000 employees across 9 Grady locations received 7 weeks of fresh produce along with printed recipes and nutrition education via email, webinars, and in-person cooking classes. About 50% of these employees had a chronic condition and reported cost to be the #1 barrier to eating more fruits and vegetables. At program completion, frequency of fruit and vegetable consumption increased, and more employees reported being in the action and maintenance phases of stages of change. Employees also reported being highly satisfied with the program and shared many examples of healthy meals and lessons learned and expressed great appreciation for the program.
Despite disruptions of the pandemic, the partners remain committed to our mission to combat food insecurity and improve health. Because of the established partnership, its flexibility and expertise, Grady has been able to greatly increase food and nutrition offerings for both patients and employees.
As the Food is Medicine partners continue to adjust to changes in the healthcare environment, food supply chain, as well as social and economic impacts, we are carefully considering sustainability, evaluation, and new innovations to meet the needs of our community.
Finally, we would like to recognize the commitment of all of our incredible partners and thank our colleagues who make these programs a reality.
Hey everybody, it's Celia and Joe Ward-Wallace. We are the founders of South LA Cafe and Market here in South Central Los Angeles.
Yes.
This is a community gathering space. It is a coffee shop, a market, a cultural center. And why did we start this space, babe? What can you tell the folks?
What do you mean, why did we start? We started because we wanted to have something that we could go to in our neighborhood that we could feel comfortable in, that we can have our friends in, that we can have our community come to and feel like they're a part of it and have a safe space.
And also we live in the inner city, and often in inner cities there's disinvestment and underfunding and not a lot of access to healthy food options.
Right.
And so in combination with our cafe and our market, we were able to provide access to fresh, healthy, and affordable food to the community. We opened in November, and then what happened, babe?
And then COVID happened.
Really wanted to show up for our community,
right,
who is predominantly lower income, Black and brown community, and in the face of COVID-19, they were the most at risk for catching COVID-19, but also having disproportionate negative outcomes, health outcomes. And so a few things that we did to help them that were aligned with our vision of creating more food access, healthy food access, was we partnered with the council office and we created a senior meal program.
Yes.
Where we literally delivered, Joe did delivery
Yes.
to I think over 2,000 to 3,000 senior citizens over just a short 3 months. We were able to cook meals, healthy meals, vegan meals, and deliver it door to door. We hope that you feel inspired and continue this movement to feed people in the community.
In April 2015, after the death of Freddie Gray, in a series of direct actions known as the Baltimore Uprising, a group of 5 companies came together in an effort to collectively make change in Baltimore. Upon the onset of COVID-19, a group of now 14 public and private partners united to address many of the issues caused by the public health crisis. The group has grown to over 24 companies that continue to come together to help further realize the amazing community assets of Baltimore.
I've been a part of the Baltimore Free Farm since 2015. The people who we feed, they come to us and they tell us the first decent meal they had all day or all week or even all month. So, you know, it's very gratifying to know that you're doing something to help people.
Strength of Love 2 provided fresh salads with tomatoes and homegrown cucumbers. This was part of the funding that we were able to do. We started with 50 the first time. Ever since then, we've been doing 100 every other week. introducing our community to something that's fresh, you know, something that's more nourishing than the fried foods that unfortunately is all that we're catered to.
As the food system started to break down, restaurants closed, hotels closed, all of a sudden you had food waste that was different, and we had more of it. So the ARABers stepped up and began to do 2 food giveaways per week.
I think what was really helpful for us with this funding, especially in a time of such uncertainty, was like the turnaround and the speed with which things happened. The application, for example, was manageable. It didn't require 3 weeks of working on something and then 4 months until we heard back.
That money came at a time when we really, really needed it, because it had gotten to a point where we didn't know whether we should keep the building or not, with nothing coming in and everything going out. So with that grant, that gave us a little breathing room. So I mean, it is a lifesaver for us.
And that's what the funding did. It brought about collaboration and enabled us to not just reach what we, initially had said we were going to do. We even went beyond. We were able to supply hot meals to the seniors at a senior center.
Together, we donated over $1 million to support 50-plus community organizations, who then provided over 370,000 meals to individuals in need.
I think that we have to reevaluate how we distribute funds to nonprofit organizations. Because if we really want to fund community organizations that are community-led and have community input, then we need to look at going into the communities and seeing what's really happening and really talking with people.
We know what the community needs because we live there, we work there, we worship there.
We will continue to utilize the power of partnership, community, and grassroots organizations to make intentional impact throughout the city. We'll continue to work together to be Baltimore strong.
When COVID hit, communities everywhere responded by ramping up food distribution to meet the needs of the food insecure. Family Cook provides the tools and skills to economically prepare food and stretch limited resources, and it's all achieved by youth. This summer in New York City alone, over 200 youth virtually participated in our Teen Battle Chef program. They surprised us with their ability to gain cooking skills and incorporate healthier food behaviors in only 5 weeks.
Hey guys, today we are going to be creating our own salsa.
More than half of them said that they've made recipes multiple times for their families. So I think that's a really good indication that what we're doing is sticking, and because it's already happening in their kitchen, they already have that sense of familiarity with moving around the kitchen and using all of their own products.
Well, I was surprised how quickly they adapted to the virtual model, learning faster that I see in the actual model, which again was surprising.
Students, I was surprised how much they're willing to talk about their feelings and skills and things like that, and have them, and they were very happy. They weren't shy.
We built a classroom of safety to learn, and that they trust us and trust me and they trust the program. When we asked them to reflect, they all looked inward and they all came up with unbelievable answers.
I don't think the money was an issue. It could be, but I think we use such an economical ingredients. buying those in their neighborhoods. I cannot believe that will break the economy of their household.
There were days where kids told me they weren't cooking, and I would say, what do you have? I'd say, do you have, pasta, or do you have beans in your house? Yes. Do you have a tomato? Yes. Do you have an onion? Yes. Okay, then you can make chili. I was excited that so many of the kids learned life lessons, organization. They talked about that it's worth it. It's worth it to put in more effort. Quite a few talked about they were eating so many more vegetables. And then when the first person who talked about that, a lot of the group and the kids all kind of nodded and said yes. One child said that now that even when they eat their sandwich, they have to put some vegetables on it.
I can tell that they all feel great having learned how to cook. They feel confident that they can put together a meal.
And the stuff they're saying is profound. Almost everyone says not just their cooking skills, but their confidence as people improved. And it was an opportunity for me to explain that, right, this isn't just cooking club, this is true youth development. This is what happens when a program is successful, that teaches you to self-advocate for yourself, that teaches you to build your self-esteem and your confidence, and how it affects every area in your life, not just cooking.
That was such a robust summer. I feel like I was able to answer those questions, and that the question about can they actually learn the same things was a resounding yes.
I used to eat less nutritious foods. Now I eat healthier. My family used to think I can't cook. Now they call me a chef. Goodbye.
The World Health Organization recommends breast milk as the best source of nourishment for infants and young children. Benefits to mothers and children are well documented, as are inequities in breastfeeding rates based on class, race, and ethnicity. Breastfeeding can also mitigate food insecurity since it provides access to sufficient, safe, nutritious food. However, in the U.S., low-income minority families are most likely to experience food insecurity and are less likely to breastfeed.
The Breastfeeding Heritage and Pride program was developed through community research by the Hispanic Health Council. Hispanic Health Council is a community-based organization headquartered in Hartford, Connecticut. This evidence-based program addresses breastfeeding inequities among low-income minority mothers in Connecticut and Massachusetts.
Given the success of this program, the Hispanic Health Council is currently partnering with both St. Francis Hospital and Medical Center, which is part of Trinity Health of New England, and Yale University, both on program replication and a national expansion throughout Trinity Health. Project staff at St. Francis support the planning and implementation of these processes.
The program is staffed by trained peer counselors, frontline community health workers who receive clinical guidance and backup from an international board-certified lactation consultant. The peer counselors provide breastfeeding education and support, starting prenatally and continuing until the baby's first birthday. In-person service contacts are conducted in prenatal and maternity care facilities, participants' homes, and other convenient locations, and are supplemented by telephone support.
Hola, Nive, ¿cómo estás?
Hola, muy bien.
The COVID-19 pandemic required a rapid shift to remote service delivery, with peer counselors substituting their in-person visits with video conferencing, which is a novel approach to delivering breastfeeding counseling to low-income women. With the peer counselors now based out of their homes, training and supportive supervision were provided to help them address challenges related to working remotely, including the modification of program protocols and tools
and the use of video conferencing technology like Zoom or WebEx to engage and support participants.
Rapidly changing COVID guidelines and COVID-related inequities in disease risk and access to information necessitated the provision of additional supports. Educational handouts about COVID and breastfeeding were developed and provided to participants with masks. As the pandemic also worsened pre-existing economic challenges in this population, the Hispanic Health Council provided resources to meet basic needs such as food, rent, and hygiene supplies.
Gracias a mi consejera por ayudarme tanto, por ayudarme a lactar a mi bebé en este tiempo de pandemia, ya que no pudo visitarme, pero siempre ha estado pendiente de mí por medio de texto, por medio de videollamada y llamada. Gracias por responder mis preguntas y mis dudas y seguir ayudándome a lactar a mi bebé.
Hi, Jennifer here. It has been very challenging but also very rewarding to help our program participants during these difficult times. We had to figure out a lot of things like how to contact them, how to educate them without being in person, how to help them with basic breastfeeding and breastfeeding problems when we were right there in their homes. And I think I was able to do this well because I have a good relationship with my participants and they trust me, and I'm very thankful with them for letting me be here through this journey.
In a pandemic that impacted its target population disproportionately, Breastfeeding Heritage and Pride continue to provide essential breastfeeding services supporting optimal nutrition and food security.
The COVID-19 pandemic spread swiftly, quietly, and lethally through the elderly, among those living or working in crowded conditions, and among people with underlying health issues. Many in our community are wary of leaving their homes for these reasons. Conversations with staff at a few housing complexes in our neighborhood have revealed a number of needs. Some food supplies are dwindling, residents are more afraid to leave their homes, and many residents lack adequate access to hygiene and care products. Access to these things not only supports personal dignity, it also is likely to reduce the likelihood of transmission of the novel coronavirus. In order to help address these challenges, we've been partnering with Food for Thought to deliver care kits to a few housing complexes in Uptown. We've been able to expand this program with the help of the United Way of Northwest Ohio and their COVID-19 Emergency Response Fund.